Well, hello there.
Hello.
Welcome to Flawed Femmes.
Welcome. It's
And
cold in
It
the
is
north.
cold up in the north. It is nice up here at the Flawed Femmes farmhouse.
It's not our farmhouse. We're borrowing a farmhouse.
Oh, yeah. We're just here on Fridays in the winter.
Yes.
But we did just partake in a hot tub in the freezing cold snow.
We don't have a hot tub in our houses.
No, it
but
was
we
phenomenal.
borrowed the hell out of one today.
We sure did. And shout out to the hosts of that. So shout out.
And for letting us podcast from their quiet country location.
Breathtakingly epic, beautiful abode, of which one of their water pitchers, you guys, I am currently eBay stalking at the moment.
Yeah.
Because I must own it as well. So I think today we were going to talk about strokes.
Stroke stories.
Stroke stories.
Stroke.
There was a time when Molly and I first met where I called us the Strokes, which you guys, yes, it is the name of a band.
But we are Stroke sisters.
We are Stroke sisters, but also it was given that there were other inappropriate connotations.
Oh, yes. That was why we did away with the name.
That
Yes.
is why the
It
name.
was, the Stroke.
No bueno. Throughout our podcasts, our previous and future podcasts, we will refer to not only our strokes, but also our lack of ability to take hormones.
Yes. Because
Even saying that makes me so depressed.
so sad. It's the saddest story ever. And many, many people, when we start to talk about menopause, they're like, let me stop you right there.
HRT.
And tell you about how HRT has changed everything.
Everything.
And we're trying to cut in and be like, wait. So if you aren't aware of this, particularly estrogen can cause blood clotting. And you know what else happens with blood clotting is you can
Stroke out.
have a stroke.
That's
So
true.
they don't like to increase your chance of having a stroke by giving you any hormones.
Which
So-
is crazy.
Because hormones are invisible and largely imaginary, right? No, they're real. They're real, unfortunately. Or
Strike
fortunately,
that. They are real.
they are real.
Very real.
And so that was how we got into the whole raw dogging menopause thing, because we cannot, take some of these supplements that other fabulous femmes are experiencing as they go through the
We're just
change
gonna-
of life.
We're just going to bareback through it.
We're barebacking this because we thought that we couldn't constantly reference strokes without mentioning what our own stories are. We are going to offer our review at the end is going to be different types of blood thinners.
And our
Huzzah!
experiences with those blood thinners, positive, negative. Okay,
Yeah.
spoiler alert, they're all pretty freaking negative. Okay?
Oh, well, they do keep you alive.
I mean, they keep you alive, but what the fuck? It's so exhausting. It's like so much work.
Barbara just wants tattoos, and you can't get a ton of tattoos. Tattoos are a little bit tricky on blood thinners.
But guess what? I do it anyway.
You can do it anyway.
I do.
So we were going to start with Barbara's story today. Barbara's,
Hello.
yes.
Welcome. Yes. So this is we're gonna go down a little.
It's a journey.
It's a journey. It's a little memory lane-ish now that I am of the older sorts.
It's true. We both had strokes in our 20s.
Yep. I was 25. So if we're doing math, it's, which I'm not great at, in 2002, let's go back there in our minds to in 2002, I had just graduated with my master's in social work. Yes, thank you. Was I the speaker of my class? Possibly. We don't need to divulge that, but yes, I was. My husband and I had just gotten married, and I was playing professional women's football and doing individual and group counseling for adolescent girls up in Maine.
Sounds like you were kind of killing it.
I don't want to say that I was killing it, but I absolutely was crushing life in general. My husband and I were working nights and weekends and holidays at an autistic home so that we could save money to get a home, a house. I mean, listen, you guys, it's pretty storybook.
So a home for folks with autism? Is that
where we worked?
okay?
And we were saving money to buy a home for us, for the family that we would create. And our plan was that with my master's in social work, I would hang out a
Flag.
What are those? Sign?
You'd roll.
No,
roll
but
out
what are those called? You're gonna have to. I'm sorry.
A flag.
No, like in you're like, oh, this announces who I am. A shingle?
A shingle.
Okay.
Yeah.
Our plan was that we were going to hang out a shingle since I would have I do have my master's in social work, and I would hang out a shingle and I would do counseling, rake in the dough, which FYI, spoiler alert, if you want to be a social worker, listen, just don't marry or be with someone well off because it's going to be a rough road for you. Anyways, financially, not spiritually.
Yes,
or
emotionally.
Emotionally, morally, you're gonna
fulfilling.
Yeah, but you'll live in a apartment in the basement probably. So, anyways, that was our plan, was for me to work full time, and when we had children, for my husband to take care of them. And it's Christmas. Ready?
It's
Christmas 2002. God, what? Yeah, no, it's 2002. Okay.
Yeah.
That's very long ago.
23 years. 30. No, 23 years. 23 years.
Not 33 years, Trina.
Yeah, you're not that old.
Yet. So, long story short, I got really sick. We contacted my doctor. It was
nauseous?
Yep. I had the worst headache I've ever had. I was throwing up. My husband offered to let me know that it was time for bed. We had contacted my doctor numerous times. They said that I was just dehydrated, to push fluids. And so my husband then told me it was
drink fluids. You had to drink fluids.
Push fluids.
Push fluids is through an IV.
Oh.
You literally push them. Okay.
Well,
you're gonna drink some fluids.
Yeah, drink some fluids.
Fluid up.
And my husband told me it was time to go to bed. I let him know that I could not make it to bed, that I was too tired. Now, y'all, sometimes I can be a little dramatic. So it's true. By me saying I couldn't make it to bed is a little bit different than, say, Molly or someone else saying they can't make it to bed. That's like, or even my husband, if my husband had said I can't make it to bed, all bets are off. Ambulance is coming. It's a big deal. And my husband asked me if I wanted to go to the emergency room. I, of course, said no, because who wants to be in the emergency room the day after Christmas? Please. Carried me to bed, and I fell asleep. And that's the last thing I remember for about 3 weeks.
3 weeks.
3 weeks. End of story. And that's it. So there you go. So from all of these many years, I have gotten the full story. My mom came over the next day. My husband went to work. I went to the emergency room. At this point, I was unconscious, and they assumed that I was using alcohol or drugs and said that they would not provide a wheelchair for me to enter the facility. Which, side note, even if I had been using drugs, which I clearly was not, shouldn't I? Don't I still deserve a wheelchair? I mean, what the fuck?
On. Incidentally, now that we know so many other people who've had stroke, particularly women, I feel like
It's kind of crazy.
have gotten turned away for suspected drug use.
Which is...
We have a friend that was put in a cab 5 times going back and forth between the emergency room and the doctor's office.
It's like pretty messed up. And spoiler alert, that same friend was at the same place where I was. And someone was like, did you hear about this 25-year-old girl who stroked out? And it's me. Okay, so fast forward. They think it's like a million different things. Had they stayed with the diagnosis that they think I was using drugs, and they had given me the whatever medicine they give you to make you not drugged out.
Oh,
I would have died.
Yeah.
Because and so then they finally were like, oh, our bad.
Oops.
We have made a terrible mistake, and took both
You're
dying. Took my husband and my mother and just said, hey, listen, we're going to do our best, but we can't guarantee we'll save her life. Because it was so long between the oncoming of my stroke, which was when I was like super sick and all that stuff, it had been almost 24 hours. And so during that 24 hours, my brain was swelling.
And a clot means that it blocks blood flow. And there's
Yes.
2 different types of strokes. So there's a hemorrhagic stroke, which is a bleed. And then there's an ischemic stroke, which is what Barbara and I both had, which is a clot.
Correct.
Which blocks blood flow.
Correct. Yep. And so the amount of time that my brain was pushing on my skull, it caused frontal lobe damage. Your frontal lobe is pretty important. So you want to avoid injuring that at all costs.
It's important.
So they did let us know that the surgeon at the hospital I was at was as sufficient in experience as the person in Boston, which around here, Mass General is like the end all be all, right?
The best.
It's the best of the best. But for this, I had to have an emergency craniotomy. And for the emergency craniotomy, the specific surgeon happened to be there and was available to do my surgery. So they did the surgery. Basically, they put a tube in my head to let the swelling come down. And then also they opened up my brain.
That's true.
So that
Some boreholes.
basically to let my brain breathe. So I have I don't know, how big is that about?
3 or 4 inches.
3 or 4 inches scar on the back of my neck. It goes kind of up my hairline. So you can't always see it. You can just see a couple of them, right?
You can just see, the bottom.
The bottom. Okay. And so I had staples in my brain. FYI, I did have those staples replaced. Wide awake. No, no numbing. Nothing. And it hurt, you guys. It was, don't put staples in your brain.
Don't do it.
Ow. Okay. So I was fine. They were able to.
You were alive.
I was alive. I stayed in the ICU for 3 weeks. I do have like 1 or 2 moments of memories of that. Apparently, they did allow my dog at the time to come in. So I really.
Oh, Molly.
Yeah, I really do appreciate that. Oh, that's
Oh,
a great
gosh.
story.
I
That
just
is a
remembered
great story.
When.
Can we just do a little side?
Yeah, I feel like we
is
need
a
to
side
break
story
up your
'cause,
heavy
listen,
story.
This is
It's a heavy story.
a real shit. So when Molly and I met,
Barbara's
and
dog was named Molly.
We'll tell about how we met later at
Yeah.
the end, maybe. But now you tell this story. Oh my God, that's great.
So Barbara's dog was named Molly, which was spelled differently than my Molly is spelled. I just
MAULIE because she was
cute little
mauled.
boxer, and I had a bloodhound. And I was invited over for dinner. My partner couldn't come, and so I'm sitting there with Barbara and her partner Matt, and they're having dinner, and they get to the end of dinner, And Matt is like, oh, I can't eat another bite. And he looks at Barbara and says, should I offer it to Molly? I'm sitting there and I was like, wow, this is a weird couple. And I was like, well, I am pretty full, but I could, I'm like, maybe I could eat some. And Barbara and Matt look at each other, and Matt's face.
It took a little bit. It
there
took
was
a while.
like silence. And Matt just goes, Molly's the dog's name. I told you, fight crime with awkward. That was my jam.
That was definitely, Molly was taking one for the team there. She
and
was
then they were like,
okay.
why did you say you would eat off of his plate? And I'm like, I
just met him for the first time ever, and you're gonna eat his like
leftovers.
Oh man.
Yeah, it was. I was like, I wanted you guys to like me.
And,
I'll eat your leftovers.
Alerts, we did.
That's lots of spoiler alerts today.
God. Oh, that's fantastic. Oh,
so
yes,
long story short,
they let my dog come.
They let Molly come to the hospital.
Yes, which was lovely, and I have a few memories of that. So I was inpatient for 3 weeks, outpatient for 3 months. During that time, one of these fun little stories was that I had lost a lot of weight.
And shaved your head.
Oh, yes, I did shave my head. I had to because, well,
the stitches
you guys, listen, 2002 is not 1990. So it was not cool to like shave half your head.
No.
So that was not in the forefront of my brain. But anyways, in the middle of my head, they shaved it so that they could do the
You had like a
staples.
reverse mohawk.
Yes. And then I had a big square in the front where the drainage tube was. So really, I looked ridiculous. So, of course, I shaved my head. I will say I pulled off the Sinead O'Connor. And my husband shaved his head to like in solidarity. But come on, you guys. He already had like a buzz cut and he's losing his hair. I mean, like thanks for effort, I guess, but whatever. And I still don't remember any of it. So I guess I hear the story, so that was nice. But yeah, I didn't remember it at the time. So then I was outpatient for 9 months. So I lost the ability to walk, talk, write. I couldn't really do anything. And throughout my recovery, I kept getting closer and closer to living in the United States. In the northern United States. So as I was relearning, I'm going to tell you.
You've lost me.
As I was relearning how to talk, much like a child, I started with mms, which FYI, that's my husband, mom, my stepdad, my best friends, everyone's name began with a except for Tiny, which is a T. But anyways, I digress. So it actually worked out really well. But when I was relearning how to talk, I couldn't really, at first people thought I was foreign because I couldn't put various words together. And so it was kind of choppy and everyone thought that I was foreign. And then as I got a little bit more, people thought I was from the South.
Oh, interesting.
Because I would talk slow and draw things out.
Wow.
And here in New England, we do not do that. We're very fast and we are kind of like all over the place. Yeah.
We're actually going to post a video of Barbara Has a Recovery video that we're going to put online.
Yes.
And you can see, and that was
the video was pretty awesome.
Yeah,
the video was pretty awesome.
Nice.
The video is probably, I don't know, a month or two after. And so, anyways, I became a fast forward spokesperson for the Stroke Association, and I ran a marathon, which is what the video is from. I started speaking at different places. And I will never
Crimples,
be
this
100% at all. Really, how many of us are 100%? No. I still struggle with many things. One of them, and mainly because there was so long in between the beginning of my stroke and when I got treatment, causing that frontal lobe damage. So where my clot was is actually pretty cool. Go down this medical road with me, if you will. My blood clot was in my cerebellum. You have
I love that
two
word,
halves.
cerebellum.
Cerebellum. You have two halves of your cerebellum.
Yeah.
FYI, it's spelled with a C.
Yeah, cerebellum.
Cerebellum. It's not an S. Anyways, so you have two halves. So one of mine, if you took an MRI today, it's dead. It's completely black. It's all not there. But you can relearn your pathways. So that's
The
why
brain
it took
really is
so long.
magical.
I mean, phenomenal. Like just staggering. And so one of the things that I always talk about is that everybody says it's a common kind of statement like, okay, be in the best shape of your life so that you don't ever have to do all this. Well, I'm here to tell you, I was 100% in the best shape of my life. I worked out all the time. I was playing professional women's football. Just all the things. And I had a stroke. There's no family history, nothing. So the reason why I'm here talking to you today and so many other people who had strokes much, much less severe than mine are not recovered or maybe didn't even make it. Mm-hmm. And that's because they weren't in amazing shape. I was in amazing shape for the fight of my life, which I sure showed up to.
It was... You had a lot of advantages over a lot of folks who have strokes because
100%.
Your age was working with you.
Absolutely.
Your fitness was working with you. It's really one of the things that will probably come up here and there is it's extremely exhausting to recover from any kind of neurological damage. Mm-hmm. You just get tired. And now that I'm seeing how hard it is to heal as someone who's in the region of 50, I can't imagine having to heal now. And I have a lot of respect for all of the older folks who are navigating strokes because it's work. It's work.
So much work. And it's definitely, there are so many, and that's why I think I referred to as my biggest flaw, because there's so many things. I have word recall issues. Yes, I have my master's in social work, but oftentimes I will say the wrong word for things.
Barbara will never work in social work.
Very special, you guys.
Because she has aphasia, which means a tendency to say the wrong word.
And ataxia, so I might punch someone in the face.
No.
That's not how ataxia works, you guys. That's not how it works.
But long story short, it's not the traditional therapy session. Mm-hmm. You can't necessarily put a word wrong.
Right. And so I think a lot of people think I've been drinking some of the times when I'm not, because as I get more and more tired, and just random days. We all have days, right, where we're tired or more or less tired. And there'll be some days where I'm just super tired and I kind of slur my words. My balance isn't awesome. That is challenging because people don't always get it, So that's kind of one of the things. So we may throughout the podcast talk about some issues or challenges that we deal with, but that's kind of a snapshot of my story, and I feel very grateful to be here. I'm also very grateful for Molly, who went out for coffee. Tell us a little bit more about going out for coffee.
Before I talk about going out for coffee, I did want to mention Barbara said how much her brain sustained for scarring and areas that she carries that have died as part of the stroke. I had a really amazing neurologist explain to me this about how the brain works. Synapses, the way that your brain functions, you know, you have all these pathways in your brains that messages are shooting down through your brain. And he described it as a superhighway.
Yeah.
So when you have a stroke or part of your brain dies, then what happens is that essentially gets blown up or dies, or it's not a usable road anymore. What your brain does is it attempts a neurological path around the damage. So it will create new connections, but they're like an old country road that hasn't been used. And
So it's not super speedy.
it's not super speedy. So you might still be able to do it, but it won't have that same function or speed.
Maybe it snowed and is
Maybe
not
it's
plowed.
snowed. It's not plowed.
Ugh.
But the more that you use the road, the smoother it gets.
Which you guys kind of suck sometimes.
It does.
For example, if I were to do more things with my right hand, guess what? It would probably get a little better. Never 100%. But instead, do I do anything with my right hand? That is incorrect.
I mean, you really have to, and you know, PT, that type of thing can be a real drag. But once it was explained to me that way, I started to understand what it is we were trying to accomplish.
Yeah. And people do find I was right-handed, now I'm left-handed. They find that very fascinating, which I think is interesting.
I mean, it's easier. It was easier to teach your left hand how to write than it was to get your right hand to have that fine motor
Righty
function
is not
again.
going to play. Yeah. No.
And fine motor skills are easier than gross motor skills, which actually brings me to my story,
Yes.
which is really interesting.
Yes.
So I was 29, 2004. I was getting married in a couple months, captain of my rugby team, playing rugby all the time, and had practice, went to sleep, and my partner was at the fire station working as a firefighter. So there was no one at the house with me. And I woke up one morning, my arm didn't work. I
What
noticed.
do you mean by that, Molly?
I went to leave the bedroom and I went to grab the doorknob and my arm just did this dead fish kind of flop. Like it didn't. And this is one of those things where people talk about the mind-body connection and you don't really, it's hard to really get it until something happens where that gets interrupted. And all of a sudden, because my brain thinks it's doing everything right.
Right.
So you're looking at your body and you're thinking
Like,
that you're
opening
thinking
the door.
everything is going to happen the way you think it
Yeah.
will. But instead, my arm just sort of like swayed around. And I thought, this is really weird.
Very weird.
And so I opened the door with my other hand. I could use my shoulder to pull my arm up and then it would just flop down again. It was the strangest thing. So I thought maybe I pinched a nerve at rugby practice or something. I don't know. But I was going to college at the time going to college at the time. And so I had to drive into campus, which is where my spouse worked. So I called the fire station. I talked to my partner and he's like, hey, this is totally out of my league. He answers the phone. Hey, what's up? I'm like, hi. So my arm doesn't work. And Scott said, so that doesn't seem right. And I feel like this is a little out of my league. So let me grab the paramedic. So he grabbed the paramedic on duty, which was this guy named Jimmy. And Jimmy gets on the phone and he's really good at his job. He also works at a hospital too.
I mean, your husband is also good at his job.
Well, he had just started. He had only been at the fire station.
Experience with his job.
Yeah. He had only been at the fire station a couple of years. So Jimmy asked me a couple of questions. I kind of described what was going on. And he said, that doesn't sound right to me. And he said, are you coming into the station? And I said, yeah, I'm coming in. I'm going to park there. And he goes, well, just come right in and don't talk to anyone. Just come right in and talk to me because I want to see you. I want to see what's going on. And I said, okay. So I'm driving a stick shift, of course. And so I get in the car.
No.
I've only got one arm working. So I'm driving my car. I'm shifting like across my body because it's my right arm.
Yeah, why not?
And then I'm thinking, oh my God, if I have to go to the hospital, I'm going to be stuck there all day. So I stop for coffee and I grab, some coffee on the way in. And so I'm driving my standard.
Where did you stop for coffee?
So it was in Aroma Joe's. It's a New England place. So
and what did you do? Did you hold this cup of coffee in between your legs while you steered and shifted with the other hand?
Yes, something like that. And my arm is still, and I'm looking at my arm and I'm just like, this is fascinating.
This is very peculiar.
Very peculiar. It's very odd. And I drive over to the station. I walk in with one arm hanging uselessly. And the
other holding a cup of coffee.
Fresh, hot, delicious coffee. And Jimmy looks at me and he looks at the coffee and then he looks back at me and he says, "Did you fucking stop for coffee?" And I was like, yeah, I don't want to be at the hospital. Like, what if I have to go to the hospital? And so he was shaking his head at me for my behavior. Anyhow, so he actually put me through some neurological tests and he was like, just wait a minute, I'll be right back. And he stepped out of the room and what he was actually doing was saying to Scott, she's having a neurological event. This is definitely her brain. I don't know what it is, but you need to get to the hospital. I'll call ahead. So we actually ended up going to the hospital where Jimmy worked, and he called the emergency room and described and this is the part where I got really lucky. And Jimmy called ahead to the ER and said, I've just put Molly through a bunch of tests, and this is her brain. There's something going on, something neurological, whether it be it could be a whole bunch of different things. Right. And so when I got to the hospital, they were expecting me. They
knew it was neurological.
They knew it was neurological. They got me right in. I went right into a CAT scan. I went right in. Just best case scenario, right? And they were able to ascertain that I was having a stroke. They were able to respond quickly. My stroke only affected my right arm. It never went any further than that. It was a very small clot. If you look at how the brain, where it was damaged. And it's interesting now because in having doctors review my brain scans, my brain damage actually kind of looks like lupus. Like it looks like someone who's starting to develop lupus. And so I don't often get, hey, this is a stroke. Like you've had a stroke, but because it was, the size was smaller, so much smaller, but they're like, this looks a little weird. Like she's a little bit cheese holed up there. Like there's something going on. And so I was able to do really, really short outpatient rehab. There's a bunch of really annoying things I had to do, like picking up coins off of tables. By the way, which is impossible to pick up a quarter.
Super impossible. Picking up coins, also locking, unlocking, all these things I had to do.
Turning screws on
beyond horrible. But how did they stop you or treat you once they realized, oh my gosh, she's having a stroke, it's a clot? Yeah. How did they dissipate it?
So they can actually administer clot busting drugs now. And they do have, so if you can make it to the hospital and identify that you're having a stroke, and since this time, we were back 2002, 2004. Since this time, it has changed dramatically. And people have really, there's level 1 stroke center near us now. And one of the things that we really want to communicate to people is that if you are able to get to the hospital, then it can make a huge difference in your recovery.
Exactly. there's
and get identified as having a
we're
neurological
two
event.
different sides of the same coin. Molly was able to get treated right away. Awesome. I actually didn't go until, I mean, they didn't figure it out until much longer. And
Yeah.
so I think that that's a great example. And for stroke signs now, which we said like have come so far, but they are a great acronym to use is FAST.
FAST, fast.
So F is face drooping or weakness in your face. So you'll feel like a little,
Yeah.
like,
And someone who knows you really well might be able to tell. They might not know your face is drooping, but they might recognize that something about your face
Is off.
Is off.
is off. Yep. A is arm weakness or numbness.
Oh, could you repeat?
Molly, have you experienced that ever? Have you seen that? No. S
Weird.
is speech.
Yes.
Slurring, so don't worry, you guys. I'm not stroking out. I'm just slurring my words.
Yeah.
I'm not drunk yet.
Yeah.
Okay.
It could happen.
Or difficulty speaking.
Difficulty speaking or slurred speech.
Yep. And T is time. So that's kind of what we're talking about right now, is that time is very much of the essence. Call 911 immediately. It can go from a disturbance
Yes.
to a huge life forever change. So
Yeah.
it has forever rerouted the course of my life. And so if I had it taken care of soonly, if I had time is critical, then who knows what my life would have looked like. FYI, no regrets. Not a one.
So you might have symptoms that go a little bit wide. I mean, we know a woman who had fractal vision and throwing up. And so,
Yeah.
I mean, going in and having your heart monitored, because heart and stroke kind of go hand in hand, because if a clot doesn't land in your brain and cause a stroke, it can land in your heart and cause a heart attack, or, I mean, an ischemic attack or event. And so we are trying to tell people for heart and stroke care that it's really easy to not go to the hospital because when you get some of these things like, oh, I'm nauseous, but maybe if you're nauseous and your vision is not holding together, then you need to go get checked. Even now, if we have an event, something like saying the wrong words, like all of a sudden, maybe you're trying to say something and the words are not coming out correctly. You might be able to write a word if you're not able to say it, and you could just write 911.
Yes. As quickly as possible.
As quickly as possible.
And we certainly, because both of us have a history, are in our minds resistant to going to get help, because everything, even if you have scratched your finger and it's bleeding, they're probably going to want an MRI. They might think you're stroking out. Once you have a history of stroke, I mean, everything is a big
good
deal.
luck getting life insurance, by the way.
FYI. But it's still one of those things, because we realize how crucial, even if it turns out to be nothing, just go. I think I actually a couple years ago also had a TIA, and so
Trans-ischemic attack.
Apologies there.
Yeah.
And it was just for, I would say, 4 minutes maybe. I couldn't.
So it's a temporary
say the
blockage.
words. I couldn't say words. I was talking gibberish. And then it did dissipate, but I was like, nope, I'm going to go ahead and get that taken care of immediately. So I went to the ER, and it was a big thing. But I suggest that kind of treatment for everyone. And now we're in the review portion.
We are in the review portion. It made me think of it because you said Maybe when you go to the hospital because you cut your finger. Because here's the thing. If you are on blood thinners, one time I was with Barbara and she dropped a really heavy piece of metal on her leg. And she was on a real big dose of Coumadin, and her leg blew up like a couch.
Demonstration. Okay. Demo on a metal shed out back.
I didn't know that a shin could hold that much blood.
It can, Molly. It sure can. And I was like, yeah, it's fine. And Molly was like, okay. And then her partner was like, nope.
Yeah. He was
Not
like,
okay.
get in the car. Get in the car.
Yeah.
You're going to the hospital as it continued to bleed under the
skin. So Molly, what is your
favorite?
Well, just what's your review? So what happened right away after they gave you the blood? Like, did you have to take anything after that?
So they couldn't really figure out the origins of my stroke. Is a combination of a new birth control that had come out, which has now been shown to have an elevated risk of stroke. There's all these things that they tested me for. So I went through some really rigorous testing, a transesophageal echocardiogram. I'm really proud of being able to say that.
Been there, done that.
Yeah.
It's only for the special people.
It's real delightful. So they couldn't quite nail it down. So I started out on aspirin therapy where you take baby aspirin. Mm-hmm. Now, I don't know if you've heard about baby aspirin. Baby aspirin got into trouble a few years ago.
Did it? Tell me more.
Yeah, it got into trouble. And then aspirin is one of those drugs that has kind of come in and out
of fashion. Almost, it feels like.
Really has.
Yeah.
You know, when we were really little kids, if you had a fever, they give you an aspirin.
Everybody.
And
Aspirin's
then they're like,
all around.
Don't give your kid aspirin.
If you want to kill them, give it to them. Yep.
And then they started telling, now you take Tylenol, ibuprofen, or acetaminophen, and then nowadays. But if you want your blood to thin a little bit, you take some baby aspirin. Mm-hmm. But I got really nervous about that because there was some mixed information coming out. And so I probably was on baby aspirin for, I don't know, 10 years? Did you went straight to Coumadin, right?
I sure did. So Coumadin is a blood thinner. And often you'll say, Barbara, but wait, isn't that what my grandmother's on? And the answer is yes. Yes, it is what she's on. I take it, your grandparents take it, but really what it does is thins your blood to a certain juncture. So I have cardio anti-lipid bodies, which is a very sexy diagnosis, and lupus anticoagulants, which is not lupus, but it is. So those two combos you never want to have together, but I do because I'm super special. It makes my blood thicker. So I take Coumadin, which is a blood thinner. So my blood is, everyone has like different levels. They might say between 2.0 and 3.0. For me, it's 2.5 to 3.5.
Oh, and you also have the anti-lupus coagulant.
That is what I just talked about.
That's what you just said. Yeah. I also have that, but apparently without other factors, it's not.
It doesn't even matter.
It doesn't matter. And it doesn't mean you have lupus.
No, so that's lupus anticoagulants is what you have.
Something.
And I have that and
something
anti-cardio, anti-lipid bodies.
Okay.
It's the whole shebang.
Yeah. I was temporarily distracted because I had to look up the baby aspirin study.
Oh, interesting. Yeah. And so I have been on that for 23 years in one form or another. Molly, why don't you tell us what that other form?
No, I don't think you can talk about Coumadin without talking about the testing.
Oh, God.
Because that's something that
is true.
Folks who might be starting Coumadin or asked about Coumadin.
Okay. So first of all, the thing about Coumadin is consistency, right?
Right.
So my grandmother, this is in real life, my grandmother does take Coumadin and she avoids everything that has vitamin K. She's like, which is green leafy vegetables, broccoli, like all the things. She also doesn't drink because alcohol is a blood thinner. Now, then you look over my way and I do drink. I do eat all the things and I just do everything consistently. So I wouldn't all of a sudden eat like a ton of broccoli and then not eat any broccoli for like 3 weeks or whatever. I'm supposed to get my blood tested 1 to 3 weeks. Like every 1 to 3 weeks for, my whole life. So I often do not do that.
Yeah.
I am listen, the Coumadin clinic is like, constantly like, Barbara, it's been like
You got to get in
4
here.
weeks. I mean, come on, give us a little something. The reason why I'm not there all the time, which I should be, yes, okay, but this is a podcast. We're being honest.
We're flawed.
We're flawed. Is that I have been on essentially the same exact dose between 10 and 11 and 12 milligrams for my entire life. I've never been super dramatic except for when I had an extremely stressful situation in my life, or if I'm taking like a random medicine or something like that. But otherwise, it's pretty much the same. But yes, you do have to go and get your blood drawn, and it's a pain in the ass. And so I don't do it all the time.
But you're alive.
I am a lot. Oh,
Yeah.
yes. And I have asked numerous hematologists, which are blood doctors,
Yeah.
if I could not take Coumadin. And the answer is this one hematologist who really had horrible bedside manner, but obviously was a doctor and super smart, was like, well, yeah, if you want to die. Thanks for that update, sir. So I stopped seeing him. Molly, what's another version of Coumadin? Have you ever taken Coumadin?
Oh, yes. Well, so funny you should ask, because did you know that pregnancy is a hypercoagulative state?
Hypercoagulative means that you have thicker blood.
Yeah,
Please
because
continue.
guess what? Hormones.
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 Yes. Oh my God, that's perfect. Hormones.
The hormones were in full action, but all of the blood thinning medications you take orally go across the brain, go across the
Fetus.
Yeah, it goes across, what is it? The
Umbilical cord?
Yeah, it goes across the divide.
It is processed through the fetus.
Yeah, like it goes through the fetus. There's a name for it that I had a minute ago, but it went across. So it permeates the membrane of the uterus. So you cannot take a blood thinner orally. So what I then was taking was Lovenox, and Lovenox is injected subcutaneously, which is how Barbara and I met.
And yes,
we were just shooting up blood thinners,
which basically
in the
means
alley,
subcutaneously.
outside.
Basically means we took injections. So when you hear about people trying for IVF, putting hormones in their body, any of that stuff, they are doing injections. So we also were doing injections.
Yes. So we were doing them. We actually had a mutual friend that was like, your life sucks because you're doing injections all the time, and your life sucks because you're doing injections all the time.
You guys should be
You
friends.
guys should be friends, which we did. We were friends immediately.
Immediately fell in love with each other. Immediate.
So we did that. Now, interestingly enough, Lovenox has a pretty long half-life in the body. So as I got closer, because I did carry pregnancy to full term, as I got closer, they switched me to heparin. Have you had heparin?
Yes, I've had both.
Yeah. When were you doing the heparin?
I did heparin when I was still in the
Hospital.
ER. Yeah.
Yeah.
Because so heparin has a shorter half-life.
So it goes through your system faster.
So it's in and out. So they certainly don't want to, especially when you're going to birth a baby.
They don't want you to bleed out on the
They don't want to
table.
risk hemorrhage. So there's that constant balance, right, between too much, having your blood too thin and having your blood not thin enough.
Yeah.
So you change between them all. But I definitely had at one juncture, I was doing IVF and I was on Lovenox twice a day.
Oh my God, it was all the injections.
So I was doing probably 5 injections every day for like a year and a half.
We looked beaten.
Yeah,
And
we had,
I wasn't
like,
even doing the
bruises
fertility.
everywhere.
Pregnant woman with bruises all over her belly looks real bad on the beach, guys.
It's really classy. Everyone's really impressed.
Everyone thought I was pretty great, that I was putting myself in some situation to have a bruised belly.
Oh, Lord.
But you use up all the skin you have. Like, essentially.
You can't. You do it everywhere.
Yeah, you do it everywhere. And so, and it does get sore.
Except in your face.
Except in your face.
That's the one.
So
place
if
you
it got
gotta
rid
do
of
it.
wrinkles, I might have gone, like, if I could have shot it into my face and had it somehow get rid of wrinkles, that would have been ideal.
Is that a possibility?
I know. Is that our
The
next?
fuck? I might change my blood thinner to Lovenox just so I can do those. Oh, but they would be black and blue. Would you prefer a wrinkle or a black and blue on your face?
It's a great question. Rugby player. So that's our review of a bunch of the different blood thinners. So look, if you are still able to tolerate baby aspirin and do the daily thing, there's lots of people making that work after heart and stroke. You need the daily. You need daily monitor. Coumadin's your boy, and Lovenox.
But definitely stay in the best. You want to be as healthy as you can.
And that's why we're doing this. The more that you take care of yourself, the more self-care you do, the better you are at handling adversity when it comes
In
up.
your body.
In your body.
I
like
mean,
this.
listen,
Yeah.
we'll talk about handling adversity in life, but adversity in your body.
In your body specifically.
Be
your
healthy.
body needs
Just
you.
fight that stuff, you guys. Fight
your
that.
body
And
needs
remember,
you.
like, someone somewhere can't do it, is not doing what you can do. I can remember when I was going through rehab for 9 months, all I wanted to do was rush. So part of my PT was that I'd have to go in the mall and do freaking laps.
I almost passed out in the mall. The mall is like the most overwhelming place for an
It's
injured
so
brain.
awful.
Yeah. I had to get a wheelchair in the mall. How embarrassing is that?
And
I
this
can't
is
function.
this is not true now
Yeah.
because the mall is pretty sad now.
Yeah, we have a sad mall. Yeah.
But back in the day, yeah, absolutely. And I would watch people rush by me, and I was like, I want to be one of those people. So every once in a while, when I am rushing around, I stop and say, I'm so grateful to be able to rush and do all the things.
And I did mention needing a wheelchair. It wasn't needing the wheelchair that was the problem. I know a lot of people who are wheelchair users who are amazing. And wheelchair rugby is super awesome. It's called Murder Ball, and I love it. And you should all be fans. There was a movie, I think, called Murder Ball too.
Yeah, there was. So good.
It's so good. It is humbling to witness your body not cooperating with you. And though we've had extreme examples, there's a couple of things we can walk away with here. One, wellness is real. You need it, and you need to support your body and its growth. Two, the mind-body connection is real.
Absolutely.
It's
real.
magical, and no one knows exactly how it works, but it's real.
It's working
weird.
somehow.
It somehow works. Your brain can talk to your body if you're lucky.
Yeah, if you play your cards right.
If you play your
cards right and
your
you take your
brain
medicine,
can talk to your body.
Your brain and your body will talk. You guys, go and be
Fabulously?
No.
No.
I say go and be, and you say flawed femmes.
No, that isn't fucking fabulous.
Oh, okay. Go be a fucking fabulous
Flawed femme.
Bye.
Bye.